Good afternoon. Thank you everyone for joining us on this lovely sunny day. I'm just going to give people a few more minutes to log in, and then we will get started with today's webinar, where we will be highlighting South Sound 211 and their behavioral health navigation program. So again, thank you all for joining us. We will get started here shortly. All right, well, thank you again, everyone, for joining us on this lovely sunny afternoon. I really appreciate you all for joining us here today. My name is Ashley Mangum, and I have the honor and privilege of serving as a project manager for Kids Mental Health Pierce County. And if you're not familiar with Kids Mental Health Pierce County, we are a community collaborative that's aimed at streamlining and coordinating behavioral health services for school-aged kids here in Pierce County. So we are absolutely dedicated to developing a coordinated, responsive behavioral health system that meets the needs of children and youth and families at the right time, in the best place, and with the best outcome for every family. So today's webinar is a Pierce County service highlight featuring South Sound 211 and their behavioral health navigation services. We have been doing these webinars for the last year in hopes of sharing resources and information as parents and caregivers, and also as an opportunity to highlight different services that we have available here in Pierce County. And I had the opportunity of being introduced to this program actually early on the pandemic, when we agreed as providers to really elevate this as our behavioral health navigation and our single entry point for behavioral health services. And so it's great to know that we have a resource like this. And I think that a lot of times people don't think of behavioral health navigation when they think of South Sound 211 and the other resources that they have available. So it was really important for us to highlight the services available today and be able to share this information with the community. A second goal for today is to provide a forum of community support where we can also learn from each other. So I want you to use that Q&A button below, as well as that chat button. So go ahead and introduce yourself. If you're a provider, if you're a parent, use that chat box so that we know who we have here today. And then if you have any suggestions or recommendations that might be helpful for another participant, please feel free to use that chat box as well. We will do our best to answer all the questions that come up through this webinar. And if we're not able to get to those questions, we hope to be able to follow up with you after today's recorded webinar. But because we have limited time today, we do ask if you have case-specific questions that you submit them via email, and I'm happy to follow up with Sarah and Tracy after today's recording as well. So again, thank you guys all so much for joining us for our month's webinar. And again, this is a Pierce County service highlight, and we will be hearing from our partners at the United Way of Pierce County's South Sound 211 program. So it is my absolute pleasure today to introduce Tracy Bomar and Sarah T. And I'm going to introduce Tracy first. So Tracy is a 211 behavioral health navigator. She served with the Department of Children and Youth and Families before coming to the United Way in 2020. Tracy quickly activated in response to the pandemic. Her commitment to serve children, adults, and families who are pursuing behavioral health services is grounded in Tracy's belief that knowing where to go is the first step in the right direction. Tracy is a proud mother and grandmother and is pursuing her peer counselor certification in July. Next, I have the privilege of introducing Sarah T., South Sound's 211 data manager, and she has been a member of the United Way of Pierce County team for over a decade. Sarah began working to organize and oversee the resource database in 2009, is certified in her role, and led 211 to achieve accreditation by the Alliance of Information and Referral Systems. She is passionate about our friends and family and the community accessing the resources they need. So thank you both, Tracy and Sarah, for being here today. And I'm going to hand it over to Tracy for your presentation.
Thank you, Ashley. Thanks for having us today. So as you've been told, that I am the Behavioral Health Navigator here at 211, and it's a pleasure to be able to explain more information about what we do. So let's start with what a 211 call is. It's a traditional type information and referral service, but it is handled predominantly by phone call. And we have a creative conversation with our callers, and we've been specifically trained to handle those calls and to have those conversations that meet the needs of those callers. It's a place where we communicate, we can be heard, and they can be able to know that we're listening to them, that we're helping them navigate through what their concerns are, kind of take the top layers off and be able to help them get to what they really need. And sometimes unearth what they actually don't realize yet that they do need. Um, and then they also are screened. We ask them questions, basic questions for phone conversation and record. Then we also ask them eligibility questions because that helps us know the different areas that they may need assistance with or referrals for that they may not realize yet. And it kind of helps them navigate through some things that they're working on by calling us in the first place. The other thing that we offer is transportation navigators, the housing solution navigators, family support navigators, workforce development. The transportation is for persons who need help with being able to get to the doctor or get to a grocery store. And they've been enhanced in certain transportation services for the pandemic era and the situations that have arose from that. The Housing Solutions Navigator helps those who are experiencing homelessness and need other types of navigator resources. Family Support Navigators help with children, predominantly with the 5-year-olds and under with Help Me Grow, and they help moms and dads navigate through those challenges of parenting. The Workforce Navigator also helps with people who are unemployed or want to change careers and want to find those resources that may be helpful to them in order to accomplish those goals they have in mind. The next thing that I want to talk about more is helping our callers who are looking for behavioral health services. They sometimes don't really know what they're looking for. They just know what their issues or symptoms or circumstances are. They may be calling to help a child. They may be calling to help a student. They may be calling to help a parent. And they don't know where to begin. And so as a behavioral health navigator, I try to just listen to their story first, kind of see all the different areas and concerns that they have, and then try to figure out what is the best way to go about helping them. And then sometimes they decide that they may not be ready yet. And I always encourage them to call back, or I can call them and update with them to see if they're ready for those services. We also try to navigate how to close the gaps of need as far as the resources matching the agency needs or the resources matching the needs for the person that's calling. Sometimes it's kind of difficult to know exactly how to gap those needs, but that is an ongoing process that we always have because we're always pursuing more excellence in how we're serving our callers for behavioral health needs. And the gamut is broad. It includes so many different aspects and age brackets and circumstances and lifestyles. So we also offer follow-ups for them. We offer follow-ups for callers who have pursued behavioral health needs, and that enables us to kind of connect with them, see if they were able to follow through, and if they were, what their experience was. It enables us to know how their services were during the actual 211 call with one of our agents, so that we can kind of navigate how they are able to properly serve the caller and communicate with them, allow them to unpack the things that are holding down the real needs that they have and why they're calling, to be able to help those agents if they need some extra support in their training or their follow-ups with how they've managed that call, to be able to teach them and encourage them on ways to expand their understanding. They also help with knowing how the caller perceived the services that the agent gave them and what they may have felt as a result of that call or experienced, and how it left them feeling when they were completed with the call with the resources that they were given. The other thing is to know how the agencies are actually performing and if they are serving in the ways that they are committing to on paper when they give us the documentation of what their services are and their hours and availability and how they connect with those callers that they may serve. Sometimes we need to update those things. And so that also helps us to update what their services are or what they've changed into and how to go about moving forward with offering those services and connecting the right resources to the caller. It also helps us know if the caller is a little more leery after the call to connect with those services and to kind of give them encouragement to understand that it is scary, it is intimidating, but it is doable, and that they can pursue those helps and that they can find the results of healing and health that they are looking for. Sometimes those callers are in extreme distress, and we also can offer them a crisis intervention line or a warm talk line that can help them know that they have a place that they can go to when 211 is closed, or they don't have anyone in their home to talk to, or they need someone just to talk to and vent some of that extra steam so they can keep seeing the direction that they need to follow in to get that help and that production and healing and progress that they need. So with that, the next thing that I have is to explain what a good call is when the needs are complex and what they may require. Questions can arise outside of what is needed. There's also the option of having people email if they have no phone or they aren't able to connect with us by phone and take that time, or they're in a hurry and they just need to send a quick email and go on with their day. They can always connect with us by email and put in those requests. And then what we would do is we would send questions to them to kind of get some eligibility information and connection information, and then find what resources they really need by unpacking through those questions. And that also can be helpful for the caller when they can't take that time to call because they're at work or they're watching their children or they're on an errand and they're driving, whatever the case is. They may be able to utilize their phone for their email services. So those are all ways that they can actually have ways to connect with us in addition to a phone call. And that's where they would email us at 211@uwpc.org. And we'll have that information as well at the end of our session here today. The other things that are of interest to offer to callers and how our database information work are going to be handled by Sarah, our database manager. And I'll hand it over to you, Sarah.
Thank you so much for that, Tracy. I'm trying to show my video so you can see me here. It's not working right now. Okay. There we go. There you go. Thank you for that. So I'll be going over how our database is structured, how you can also search it online. That's available too. So it's another way that you can access information after hours, or if you're working with a client and you've got some questions, you want to try and find some resources before you meet with them or in between sessions. So we'll be going over the database, and I will also include a link to that as well. I'll probably put those in the chat, and then we can also have Ashley post them so you guys can access that. And so I'm going to go ahead and show you how it's structured, searches that you can do, the results that you can find, and how to kind of edit or filter those so you can find what it is that you're looking for. And then, of course, we always have the phone or email options as well. So you've got a wide variety of ways to get a hold of us and get some information. And I just saw the question in the chat, so I want to let you know our office hours, Monday through Friday, 9 a.m. to 4 p.m. All right, so I'm going to go ahead and bring up our database. Also, I want to make sure you know how information is updated. So in addition to agencies being listed, we send them at a minimum of once a year their information, so they have a chance to actually review it and make sure that they are approving the language that we're using, that we've got the correct payment information, that we've got the right hours, locations, phone numbers, information, like that. And then we also use those follow-ups that Tracy mentioned to refine that information. So an agency might send us, what it is and what they do, and maybe there's some clarifications we need around eligibility because we find out that maybe a client or caller wasn't able to access them in quite the way that we had down, and so we can refine that and get those clarifying questions and refine that information that's available. And then, of course, feedback from callers, providers send in information too. So any feedback we get, we follow up with. So even though it's once a year for the official update, the database is a living, breathing thing, and it's constantly changing. So I just wanted to make sure that everybody knew that. So I'm going to go ahead and share my screen so we can kind of go over our searches. So it'll be just a second here. All right, I'm going to go ahead and turn off my video as well, so that way we can just focus on the database here. All right. So the first kind of thing that I want you to notice is that we do have a way to limit the area that you're searching. Because 211 is part of a statewide network, you can search statewide for resources. So if you're needing help with someone in a different county, you can search for information there, but we can also just limit it to Pierce County. So I'm going to go ahead and enter in a zip code of 98405, but we don't have to do just the zip code. We can also do county, city, so we can kind of narrow or expand our searches if we need to. If you'll notice here, it comes up with zip codes that we can, like it autofills the zip code for you. So you just want to make sure you select it and that you've got, the zip code selected there. Sometimes if you're using something like a Google browser, it tries to autofill it for you and it fills it from Google's autofill instead of our autofill. So just kind of keep an eye on that. And then I can also enter in, if I wanted city of Tacoma. There we go. Let's do it this way. Okay, so I can do Tacoma, and then I can also narrow it down. So maybe I want to just search the east side of Tacoma. So I can search in like 404 or 98408 if that's how I wanted to do it. We also said that we can enter in search countywide for resources. And then again, you can narrow it down to different parts of the county. So we can kind of search all over. We also have the option, we see down here, you can search by name. So if you know of a service that or an agency that you're looking for information on, that's something that you can do. It is very sensitive to spelling. So just kind of a heads up about that. And then in here, we can search by categories. So we can, if you're just looking for counseling services, I can start typing in counseling, and then I get a variety of options that I can choose from. So I can see what sounds best for me right now. And then I can also use something called the hierarchy. And it gives us a chance to look for, kind of drill down and figure out what services that we're looking for. So if I click on a name, it gives me the definition of what that service is. So I can keep going down and looking for what it is I'm looking for. So I'm going to go ahead and go in and I can select like general counseling here. I get a definition of what it is. If that's what I want to look for, then I can go ahead and search for that. Sometimes the hierarchy can be pretty intimidating. It reminds people a lot of kind of the Dewey Decimal System in the library, and that's because it was created by a librarian. But it gives us a way to classify the hundreds or thousands of services that are in a comprehensive database. So while we might be focusing on just mental health or substance use disorder for the presentation here, we can use it to find other services. So that someone who may be looking for mental health services, maybe they haven't been able to go to work as much, so now they're going to need help with a utility bill, so we can go in and find those resources too. And so whether it be through a call or an email, we can handle multiple services if someone is in a place where they can get information on multiple services too. So I just wanted to let you know about that. So I'm going to go ahead and go back in here. I'm going to go through I've got general counseling services selected. I've got our zip code coming up. And then I can just go ahead and search for those results. So I've got a couple of services that are coming up here. I can select services by the day of the week that I could get a hold of somebody, the ages of the population served, languages that are available. We've got focus populations. We've got more down here. Especially, I know what comes up as an issue a lot is finding someone that takes a certain type of payment. So if we can look for someone doing a low cost sliding scale, and if you'll see that there, it started with the ones that are right in Tacoma. We do have some other resources coming up. Some of those services, they provide telehealth services. So while they might be situated in Seattle or Redmond, they're willing to provide services to someone from the Tacoma area. It may be helpful, especially if someone is, maybe you're living in one part of, like one part of Tacoma, but you're working in Redmond or Seattle, you can find some services up there too. So there's a lot of variety in what can come up for people. In addition to looking for payment options, I can click on, with the details that I get here, I get the address, how to reach them, when to contact them. I can visit their website if I wanted more information. We get a description about the program. So it's kind of like a tweet or a short description of what the service is and who it serves. But I can always click on service details for more information. So I'm coming up here, gives me a map of where they're located. And then I can get to this information. So I can look at the different sorts of services that they treat, how long it takes to get an appointment. Typically, in the case of PLU, they happen to charge $10 for the first 2-hour session, and then they do a sliding fee scale. So this might be an option for my callers with no insurance. Okay. So I'm going to go ahead and, like I said, we selected the low cost sliding scale. So I'm going to apply that to our search. And then we've got those services that offer that sliding scale. And so it's, like I said, a variety of services that are coming through. So I'm going to apply that. I'm going to take that feature off. That's why I'm doing that. Okay. Let's see. Make sure. Okay. Some other searches that we can do would be something like support groups. So we've got a couple different options that we can select here. I don't know if there's one in particular that we want to go to. Okay. So, but as you can see, we've got a variety that people can choose from. Sometimes I like to go to the support group clearinghouses. And so you don't have to select that one. It's just sometimes I like to look at that one because they list multiple recovery groups. So for this case, they did Cocaine Anonymous because they list, all of the support groups that might be meeting throughout the state, or because of COVID, telehealth. Same with Al-Anon, PFLAG, they might be able to connect you to local groups. So that sometimes is a helpful way to find groups. And then you can also, of course, search by just a group you need. So in this case, we had caregiver support groups. And then we can take a look here. Okay. And then we can came up with the wrong one. Yeah, so they'll come through in groups that provide support to caregivers, as well as those who are receiving like a diagnosis or disability. Another one, we looked at general counseling earlier, so I'm going to kind of go through the hierarchy. And I'm going to go again to those mental health services. And I'm going to go down to assessment and treatment. Counseling services, we selected general last time, but this time I'm going to go into specialized. And so I'm going to go ahead and click on adolescent and youth counseling for Tacoma. And Accounts, again, they serve out of area, but they serve, they provide services through telehealth. So we can get some different services that are offered to people in our area, even if the service itself is located outside of our area. So again, we've got Consejo, for example, coming up, and then Seattle Children's, even though they might be based in Seattle, again, they can provide services to our area. And I'm going to go ahead and I'm going to refresh our page here. And I'm going to change this again to look at some of the substance use services that we can provide as well. Because we know that behavioral health covers, of course, several different needs. So I'm going to go into the treatment programs and then just do comprehensive outpatient. So I'm going to go ahead and we'll search for that. Oh, and if I notice, I didn't actually click on it. So that was my fault. There we go. All right, so it decided, oh, if we notice that I didn't set an area to search for, so it searched the entire state. Again, it'll do that. So I'll go ahead and just do Tacoma. There we go. Okay, so we've got some other services that are available. And again, the ones that will serve out of area. So we've got services we can use, again, those facets to figure out if there's a specific population that's being served, a specific age group, days of the week that it's available, languages, and of course, payment options. And these do not show up, these facets, unless there is something selected with that service. So if we didn't have any private pay options, or if we didn't have any low cost sliding scale options, they wouldn't show up as an option. So I'll go ahead and click on Apple Health. can apply those. And so then some of those services have changed, but we keep going down, and we can always find those services. They're coming in a little discombobulated right now, but yeah, so those are on there. And so I did have some questions if there were any searches that anybody wanted to see. In particular, I don't have my chat up, so if there are any questions, if someone can let me know. Yeah. Take those off.
So Ashley, and feel free to use that chat box. No current questions in there right now, Sarah.
Okay. No, take it off. Yep. Let's see. I went faster than I intended to. I get so nervous about it.
Oh, no, this is great. This is a great overview, and know that this much information is available to be able to connect families with resources. So it's really helpful to see that database.
I was trying to think. Again, talking about the services and updating. Well, maybe this is more about the taxonomy in general. You know, we think of mental health services or behavioral health services as being kind of one category, but sometimes it comes out in other areas or parts of life too. So sometimes when you're doing a search or you know, you're kind of thinking of how to utilize the database. Sometimes it's really helpful to kind of do a combination of the category and the hierarchy search. So like earlier when we were looking at support groups, we noticed it'll say something like PN or whatever, and when we go into mental health, it's kind of a different category. You can't find support groups in here. For the purpose of this, they sometimes get classified in a different category, and so it's individual and family life. So I can go in here and mutual support, and then I can come down and find those support groups. And so I can take a look at different ones that might be offered. So we keep them pretty broad in this category and then kind of narrow them by the facets that are over here. But if we're looking at individual and family life, we kind of come up with other options as well. So, you know, if I'm looking at individual and family support services, then I can kind of get down into the parenting education too. And sometimes that's where we might get into those parenting helplines. So you're not in a crisis necessarily, like a mental health crisis, but you're at your, you know, you're struggling with the part of being a parent or you know, being a parent and having a child who is having some issues. And so sometimes maybe we can look in here for those parenting helplines too, or those you know, parenting education classes. Also kind of not in the mental health area, but kind of more as a support that can be available. We look for peers. So we can look for peer services or peer networking. Also just networking in general. So I'm going to look in here. I've got parent to parent networking. So I can get, you know, find out those resources that are going to help parents connect with each other so they don't feel alone or isolated. And again, it's a mental health support, but the information for it might not necessarily be in the mental health services. So I always encourage exploration of, especially if you're a case manager or a counselor, and working with a variety of households or families, I always encourage the exploration of the database. It's a growing and changing thing. And because we're a part of that statewide network, there's a lot of information that I'm putting into our database for our region specifically. But sometimes we're also getting national or statewide programs that might be located somewhere else, but are serving our area. And you might not always know that they're available to our community until we're searching in here and exploring all the different resources. And it's also a helpful way for us to find our gaps. So if there are services that you're not finding, is it because we don't have them in the community or because we don't have them in the database yet? If it's something that we don't have in the database yet, it helps me to know that it's something that we need to find and need to outreach to if we're getting feedback about what's missing. And then also it may be a way for us to show our community where there's a gap in a service. And so we can come out and say, here's a need that's not being met. My apologies. And then we can let funders or other providers know what's missing. And so we can maybe work together as a community to get that need met as well. So there's lots of potential, lots of potential with meeting the needs of our community. And so I love your help in that too.
And that is a great benefit of having a system like that, to be able to map what exists and also help to identify those gaps. There was a question that came up in the chat box about how does an organization get into the system or get updated?
Okay. So to get into the system, we get outreach from organizations directly. So they'll call in, they'll email, they'll visit the statewide website or the United Way's website and kind of reach out to us through that. There's information that we find. So like if I'm attending a community group or another partner that we work with will tell us about them, and then it's us outreaching the organization to try and get them listed. For the update process, some of the updates are automated. So we've established enough of a relationship with the provider that they know to keep an eye out for those update emails, and they can update through the website, and it's just done and fast and easy on their part. Sometimes our providers don't like updating through the website, so it's phone calls and reading over the information with them and really refining it that way. And then sometimes they'll update through the website, but they need reminders. So we're keeping track and working with them on updating. So it's a variety of options, because we know that people need a variety of ways to do things. Hope that answered.
Sarah, I did see a question that said, is there a help for people that owe money to IRS?
There may be. I think that's something that we would want to search for. Like that's something where I might recommend you either emailing or calling into 211. So you can kind of go over and see, because that might be more of a conversation. Is it a financial resource that can help pay for it? Is it a legal resource that might be able to help you negotiate something down with the IRS? So we kind of want to explore those options in a kind of in a more of a one-on-one conversation. But if we do have anything, yes, this is the database where we'd list it. So.
Sarah, and you've done an absolute great job of answering a lot of questions that were asked before when people registered for today. We know as a county that access and care coordination has been a priority actions, particularly in our youth mental health system. And we also get feedback that at times it can be difficult for families to connect to mental health services quickly. Do you have any advice for families on what they can do if they are waiting for services for behavioral health?
I think I might go ahead and send this one to Tracy.
Okay. What I would say is that's where the warm talk lines and crisis intervention call lines come in. And then possibly follow-ups I can offer, giving calls to people who may need that extra follow-up and support while they're waiting. It is a process. Sometimes they'll have to retarget where they're going for services. And we can always look up other options to see what may be available for that as well. Because sometimes the first time just isn't a good fit. And that's a process. It's a process to find the right fit for behavioral health services. So we're willing to do what we can to help and support that process. I hope that answers.
That's great to know that there's that ability to follow up and look at different levels of service while you're waiting for that, the different crisis lines or warm lines. Also, I just want to put out Kids Mental Health Pierce County has some resources in terms of our community multidisciplinary team and some other resources that may be able to assist with navigating that service as well. So again, it's great to hear of that 2-on-1 ability to follow up. And I think that was one of the questions that we got earlier too, is what type of follow-up is able to be done from 2-on-1.
Yeah, like I said before, we can do follow-ups. We will ask the caller if they would like a follow-up, because it is something that we want to respect, that if they do want that follow-up, that we ask them first. We like to have the follow-up because it helps us improve our services, but we also like to follow up to see how the process is going with them, so they know there's somebody interested and concerned with what they're experiencing, and can maybe offer some tools that they need to help continue to navigate to find those resources, because sometimes it doesn't come on the first try. Sometimes it's not what they expected it to be when they're looking for therapy or services for their autistic child, or services for a child who's struggling with drug abuse, or struggling with abuse in general. So sometimes it does take a minute, and it's helpful to be able to know, okay, I know someone's going to call and check in on me when it's stressful and confusing and frustrating, and you're trying to just get through the day. So I think that's something that's really important.
I so agree. So many times we just hear about these different resource lists and giving them out to families, and they're often and navigate a really complex system. So it's great to know that there's that closed loop, and somebody for that family to know it is going to follow up with me to help me navigate this very complex system at times. So that is absolutely great to hear. All right. Are there any other questions? Feel free to utilize that chat. I have about 15 minutes scheduled left for today. But also want to give you the opportunity to ask any questions while we have our experts from South Sound 211 available. All right. Let's see. If there are no other questions, Tracy or Sarah, did you have any final recommendations or closing words for any of our participants today that would just be helpful when utilizing your navigation services?
I'm going to go ahead and put in the chat both the email to reach us and our website, so people have that right away. And I'd always just say I really encourage people to contact us, if they have any questions, or if they want to know more about resources, or if there's just something that they want to make sure that we have it, that is really, really, really appreciated. So I just want to encourage people to feel free to communicate with us and know that we'll be communicating back with them.
Thank you. And that is awesome to have that connection and that ability. So if there are any providers on the call, please reach out to Sarah and Tracy and get your information in that database. Let them know your availability and the services that you're able to provide. The more community participation we can get in this, I think it will be a tremendous resource. I think that was a lot of the intent when we started doing these webinars, is a lot of times we talk about our gaps in services, and sometimes we don't elevate the things that actually exist currently. And this is a tremendous resource when you're trying to navigate that pathway into the behavioral health system, of utilizing this expert resource that have done great work of mapping services and keeping up to date with what providers are available. And so I did share their mental health flyer in that chat box, so you have that resource as well. I've shared it with school districts. They'll be on our website as well. And so if you have families that are navigating the system, I would highly recommend that you utilize this as a resource to give them that support that they need as they enter into the behavioral health system. So if there are no other questions, I want to thank everyone for your participation. I want to thank Tracy and Sarah for your amazing presentation and being so thorough about how to utilize that database. I always want to extend an open invitation anytime you want to come back and present. We will continue these webinars monthly. Be on the lookout. Next month, we will be highlighting our partners at the Developmental Disabilities Administration, or DDA, to get an overview on DDA services and just have the opportunity to ask some questions about the services available through them as well. So be on the lookout for that. This webinar, as well as all of our past webinars, will be available on our website, kidsmentalhealthpariscounty.org. And if there are no other questions or comments, I'm happy to allow everybody some minutes back on their day to enjoy this nice weather that we're having. So again, thank you, Sarah, thank you, Tracy, and thank you to all of our participants today.
Thank you so much.
Yes, thanks for having us.